to Kim E, the Diabetes MP. You are tuned into the Patient Corner. The Patient Corner is a segment that I created on my channel for those who are diagnosed with diabetes or have loved ones that are diagnosed with diabetes and you're looking to learn a little bit more about the diagnosis. Now today we're going to talk about something that is very, very important, okay? Something that every diabetic needs to know and have a good understanding over, and that is hypoglycemia. So if you would like to learn more about hypoglycemia and how it can affect you in diabetes, stay tuned. We're going to get into it. Now, what is hypoglycemia? Okay. Now, in a nutshell, it's basically when your blood sugar gets low. It's low blood sugar. Now, technically, you are considered to have hypoglycemia if your blood glucose is less than 70. Now, I will have to say and give a disclaimer, though that is the typical threshold that we would classify someone as having hypoglycemia, there is not one diabetic that is the same. So what may be affected by one diabetic may not be the same experience for the next diabetic. So all the more reason why it's very important for you to know what these signs and symptoms of hypoglycemia are and how that affects your body, because to be quite honest, you may not feel the symptoms of hypoglycemia at 70. You may feel it at 80. You may feel it at 60. You need to know what it is, how to anticipate it, and how to troubleshoot it and even prevent it in some instances. Now, like I just finished saying, there are signs and symptoms of hypoglycemia, and it's very important that you know what they all are, but realize that you yourself may not experience all of these signs and symptoms. These are things that may come about if you're having an episode, but you yourself may only experience one of these symptoms, maybe a handful of these symptoms, maybe none of these symptoms. The point I'm trying to make is that you yourself need to know how your body responds to low blood sugar, okay? Now, the hope is that you're not having frequent lows where you'll all the more know what it is, but you do need to know the typical classic signs. So if it happens, you'll know that, okay, I'm going into a hypoglycemic episode. This is what I need to do. I need to do something, some type of intervention. Now, I'm going to go ahead and list off the many different symptoms that you can have, signs and symptoms of hypoglycemia. I made a list of them so I didn't forget any of them. But as I'm reading this off, just think about if you yourself have experienced any of this, and think about, even if I'm not mentioning every single thing, think about other things that could be related to these signs and symptoms. So if, again, you're experiencing this, you'll know what it is. Now, it could be nervousness or anxiety. It could be shakiness, the sweats or chills. You could have confusion, dizziness, irritability. You'll be impatient. You could be sleepy, nausea, vomiting, headaches, blurred vision, tingling and numbness around the mouth and the face, even the tongue. And then you could even have a high heart rate. Your pulse could be high. Now, these are the typical symptoms that you can experience. But again, realizing that each diabetic is different, and that if you have a sister or a mother or any family member that has diabetes, that you may have a different experience than they, and vice versa. So again, it's important to educate yourself so you know how to pinpoint hypoglycemia if you were to experience it. Now, why does hypoglycemia happen? And if it happens, how do we treat it? Now, the more common reasons why hypoglycemia occur is because maybe you have too much medication on board, like your insulin. Maybe you're on medication that can cause hypoglycemia. There are differently oral medication pills that you can take for diabetes that precipitate hypoglycemia. It could also be that you're not eating enough, that you've taken your medicine, the dose is okay, but you haven't eaten, and you've just taken some insulin, but you didn't eat enough, and now your blood sugar is dropping. Also, if you're doing a strenuous physical activity, it also can drop your blood sugar as well. That's more typical in your type 1 diabetics, not so much in your type 2s, but it can happen. Now, when it comes to treatment, we can go one of two routes, and it really depends on if you are conscious or if you're non-conscious, if you've passed out. Now, if you're a person that at the moment you're having the episode and you're able to actually take in food, chew it without choking, then you would want to go by what we call the 15-15 rule. So in a nutshell, basically what this is you take in 15 grams of carbs, wait 15 minutes to check your blood sugar to see if it rises above 70. If it does not rise above 70, take another 15 grams of carbs, and you keep going like that until you get to a safe blood sugar level. Now, what 15 grams of carbs look like? This could be a regular soda, not diet, but regular. This could be 4 ounces or half a cup of juice. It could be hard candy. It could be gel tablets, glucose tablets. But one of the things that I would suggest is that whatever 15 grams of carbs that you prefer, please have it readily available. Whether keep that amount already in your purse, or keep it at your bedside and your nightstand. Have it already ready to go. So if you're having some type of episode, you don't want to have to be scurrying around trying to find things to equal up to 15 grams. And remember, one of the signs and symptoms of hypoglycemia is confusion. You may not be able to accurately get 15 grams. So it's good to already have it ready prior to any episode happening. Now, something you do want to resist doing is eating something large, a large amount of carbs, like taking in a big meal, because then you will have, when your blood sugar does normalize, it will then go ahead and have hyperglycemia. You'll have spikes in your blood sugar. So avoid taking in a large amount of carbs all at once. It's just best to stay with the 15 grams of carbs. Now, also, if you're at a stage where you're not able to safely take in food, swallow it without choking, then you would want to go the other route, and you would want to inject yourself with glucagon. You have someone else to inject you. You would want to, if you have a spouse or a child that lives with you, help them understand how to give that to you, just in case you're not able to give it to yourself. But a glucagon injection will definitely bring your blood sugar back to normal. Now, prevention. Now, our hope is that we don't even have to have any episodes. So how would we prevent these episodes? Now, one of the biggest things you can do is monitor your blood sugar regularly and adhere to the treatment plan that your provider has laid out for you. Making sure that you're taking your medications when you're supposed to, the amount that you're supposed to, and you're eating a well-balanced diet, okay? You want to make sure that you're monitoring your blood sugar before, after meals, before and after physical activity, if you're playing a sport or having an intensive workout, and even maybe in between the workout, just stopping and checking your blood sugar to make sure it's not dropping. And especially if your doctor changes up your treatment plan, like they add insulin or they change a dose or change, any medication that you're on, you want to, around that time until your body gets normal to that treatment plan, monitoring your blood sugar. And again, this may not be something that you do on a continuous basis, but if you know that you are more at risk to have these lows, these frequent lows, you want to monitor yourself until you can get stabilized. And your provider can definitely help you figuring out the frequency and how often, how long you should be monitoring your blood sugar. Well, that's all I have on hypoglycemia. I hope that you learned something about hypoglycemia. I am going to go ahead and link in the description box a link to the American Diabetes Association website that has more detail about this very subject. I as well am going to also link the other videos for the Patient Corner so you can go and learn some more about your diagnosis of diabetes. Again, I thank you for tuning in. You have been sitting here with Kim E, the Diabetes MP, and I'll catch you on the next video. Bye.